Well, too often the mentally ill wind up behind bars, incarcerated for any number of crimes that are the outcroppings of their mental state. And law enforcement officials are quick to tell you they're frequently unprepared to deal with the severity of mental illness they often face. In the first of a team report on the impact mental health has on our legal system, OETA's Lis Exon visits the Tulsa County Jail.
It is a solitary existence. There is no socializing with other inmates. Food is served through a slot in the door. Cells are windowless spaces with only a cot, sink, and a toilet, nothing that could be used to harm themselves. The letters MHE are listed by the names of inmates on a chart. It means they're waiting for a mental health evaluation. The chart also shows warnings for each shift about inmate behaviors. Major Shannon Clark is the Tulsa County Jail Administrator.
And out of the 1,800 that we house on an average, 600 are on some type of psychotropic narcotic, and that is a minimum number.
With 30,000 people jailed here each year, that could mean about 10,000 people locked up here annually suffer from mental illness. Some of those inmates are housed in a restrictive cell block. Clark says it's not what employees signed up for.
You have to come in here and deal with the people that spend the majority of their day spreading their feces around their cell because that is their form of entertainment, and then a detention officer has to uniform up in all kinds of biohazard gear to go in there and clean it up. That's what they have to do every day in this facility. People urinate on themselves, people are self-mutilators and they're cutting themselves, so you got blood in certain areas. They have to deal with this kind of stuff.
Clark says such behavior could be prevented with certain psychotropic drugs which need careful monitoring and can't be given in the jail.
Now, we have a great medical facility on staff. We have great doctors that really do care for the patients that they treat. The patients that they treat are locked in on criminal charges, so there's a lot of things they can't do for somebody they could do on the outside, or somebody they could do that would be in a hospital setting opposed to a jail setting. There's certain medications we just won't tolerate here at this facility. So there's some things that they just can't give them.
Those who are a danger to themselves or others end up in the jail's medical unit. According to the Tulsa County Sheriff's Department, this inmate, like several dozen others, doesn't even know he's in jail. His cell is next to others housing inmates suffering from physical health issues. In another cell for inmates considered suicidal, inmates ripped up the linoleum floor hoping to create a sharp object with which to kill themselves. At any given time, there can be 20 to 30 inmates on suicide watch. Michael Brose is the executive director of the Mental Health Association of Oklahoma.
And we're putting them in jail. Really? So this is a big deal, and it's been a big deal. It is a big deal. And, you know, so every day in towns and cities across Oklahoma, every day, there are people who are in an untreated state of mental illness, symptomatic, distressed, troubled at no fault of their own, and they're being picked up by the police, charges filed, and they're being taken to jail. That is going on every day.
It is a process that is completely destroyed and damaged and flawed. I don't know how else to characterize it. There is no process in place.
Major Clark says because the court system is so backlogged, the Tulsa County Jail has become the largest psychiatric facility in the state.
There's only one maximum security confinement for mental health people in Oklahoma, and it's full. We've got a waiting list for almost 30 people just from Tulsa County waiting to go. There's 76 other counties in Oklahoma.